An esophageal dilation can be done in the operating room, it can be done in the office, it can be done in a procedure suite as well. So lots of different places that you can do, but it is a stretching of the esophagus in this case. So you can use this, classically it was taught, you could use bougies or Maloney dilators. Those are always done in the OR or almost exclusively in the operating room, but with the advent of in-office dilation, you can also do this awake or in a mildly sedated procedure as well. So in this particular case, the use of a scope goes through the nose, and then the balloon goes over a guide wire and is able to actually just open up the esophagus or stretch the esophagus. The patients that we take care of here are, they're complicated patients. They're tough patients with tough problems. So again, whether the etiology of their swallowing disorder is because they have had radiation years ago, it's usually not, somebody that has had radiation recently, it's usually years and years later that they start to really get the fibrosis of radiation treatments.
Dr. Howell says radiation is the gift that keeps on giving, but I'm still here, I'm not complaining, I'm just explaining. My name is Greg Tharp. I've been suffering from dysphagia for over 10 years, and it's a result of having radiation for my medullary thyroid cancer that I had all my life since I was 30 diagnosed. Dr. Howell advised me to get the dilation done, and the first one Dr. Howell did was I was sedated, and then after that procedure, she said, Mr. Tharp, you really are a good candidate for the in-office dilation because I think you'd do well with that and you could go home right away and not be sedated.
The benefits of the office, I think, are twofold. So I think cost is a real piece, especially in today's era. They don't get the cost of anesthesia. They don't get the cost of the pre-op and the post-op care, but they don't lose the day. They can come in, the procedure itself takes maybe about 10 minutes altogether, versus, if you're under anesthesia or even IV sedation, you've functionally lost the entire day. The other piece is I also think that they start eating faster, and I think they have less pain. So in the office, I don't give anybody pain medications. They get Tylenol or ibuprofen, and that's it. I give them nothing. When I used to do more in the operating room, patients would require pain medication, and they would say they couldn't eat or drink for a couple days afterwards. In the office, I tell them to go get a smoothie on their ride home.
After the procedure, I eat lightly that day, and then the next day I'm back to normal diet. And I can even do anything I would normally do the same day if I want to go out and run errands or light yard work. But the next day I'm back to normal. Last year I was not even able to swallow pills. They'd get stuck and I wound up in the emergency room. But right now I'd say I'm the best I've been in years.